Hi, this is Colin Reese, and he's going to be here to help me today. I'm Willow Knapp, and today we're just going to be doing an assessment of your head, eyes, ears, nose, and throat today, okay? I'm going to begin this assessment with some questions and just to get a little background about you. So I think we're going to begin with the head. Have you had any history of head injuries or headaches, dizziness, or anything like that?
I had 2 concussions when I was younger. They were about 8 years ago, but I haven't had any problems since.
What brought on the concussions?
I had injured myself in wrestling. I hit my head off the mat twice, and then also playing football. I got hit in the head by another person.
Oh, I'm sorry to hear that. Have you had any long-term issues from them, or just during the recovery?
Just during the recovery.
Okay. Do you experience any hearing issues, like high pitches, low pitches?
Nope.
None at all? Okay. Do you listen to any loud music or around places that's very loud noise?
Maybe some loud music here and there, but nothing.
But you don't work in an environment?
Nope.
Okay, that would harbor that. Do you wear any contacts or glasses?
No.
Have you noticed any changes in your vision lately?
No.
No? Perfect. Does anybody in your family suffer from eye issues or hearing problems?
No.
No?
No. My parents have glasses, but it was age-related.
Okay. So do you see an eye doctor regularly because it's an age issue in your family?
Yeah, once a year.
Perfect, okay. Have you had any injuries to your mouth or your teeth or anything like that?
Other than some cavities, no.
Some cavities? Have you had your wisdom teeth removed?
Yes.
So that's surgery you've had?
Yes.
Okay. Do you normally regularly see a dentist?
Yes, every 6 months.
Every 6 months? Okay, perfect. Now that we're done with just some of the initial questioning, I'm going to begin my actual physical assessment on you, okay?
Okay.
So the first thing I'm going to do is just to look at your head.
Okay.
I'm just going to see that the size, the shape is pretty normal. It's proportionate to your body, so it doesn't seem that you have anything. I'm going to palpate your head to see if there are any bumps or lumps in there. Have you noticed anything abnormal with your head?
Nope.
You're showering or anything like that?
Mm-mm.
So I don't feel anything like that, so that's a really good sign. I'm just going to look at your you can face towards me again, sorry. I'm going to feel your temporal arteries just to make sure that there's no pain.
Mm-mm.
None?
Nope.
Okay, perfect. Now the next test that we are going to do is to check your jaws, okay? So I'm going to place my fingers here. I'm going to have you open and close your mouth for me. Okay. Do it one more time. Perfect. Now can you move your jaw to the left and the right? Perfect. The smooth motion, so you don't have any TMJ or anything like that. There's no clicking, I feel. The next thing I'm going to do is look at your neck. So I'm going to have you put your head back just a little bit. Okay. So it's symmetrical. I don't see any lumps or bumps. That's good. The next thing I'm going to do is I'm going to look at your thyroid gland. So I'm just going to have you keep your head in that position and then swallow for me. Okay, everything's moving symmetrically. There's movement. Now I'm going to have you check your range of motion just to see if there's any issues with that. Put your head down to your chin, or your chin down to your chest. Now look up at the sky. Can you turn your head to the left, to the right? Now put your ear to your shoulder. Now do it the other way. Any pain, difficulties doing that?
No.
No? Okay, that's perfect. Okay, now the next thing I'm going to do is I'm going to put my finger on your chest and I'm just going to feel for your trachea, okay?
Mm-hmm.
And then I'm going to have you swallow. Okay, perfect. So I can feel your tracheal rings. That's good. Now from there, now I'm going to palpate your thyroid gland. I'm going to have you turn around for me. And now my hands are going to be on your neck, okay?
Okay.
So I'm just going to do like a little movement. Good, swallow. Can you swallow one more time? Okay, that feels good. I'm going to do it the other way too now. Okay, things feel good. Perfect. Now I'm going to move on to assess your lymph nodes. Let me know if there's any tenderness or discomfort while I do this, okay?
Okay. No, it feels good.
Feels good?
Mm-hmm.
Down here?
Mm-mm.
Here?
Nope.
Perfect. No pain or discomfort?
No.
Okay, perfect. So after that, now I am going to look at your ears, okay?
Mhm.
So I'm just going to see if there's any pain or anything like that with this?
Nope.
No? Okay. I don't see any skin issues around your ears, anything like that. And check your other one. Okay, perfect. Now I'm going to use my otoscope, and I am going to look inside your ears just to make sure everything looks normal in there. Full disclosure, my otoscope does not work. But if I were to do this exam, I'd just pull your pin back. I'm just going to look in your ear, okay?
Mhm.
Any discomfort or anything like that?
No.
So looking through this, I should see about a pearly gray tympanic membrane. And in his left ear, I would see that the cone of light, it would be at 7 o'clock. And then I would do the same thing on this ear. Is that okay?
Mhm.
And this cone of light should be at 5 o'clock. And I would probably, knowing that he doesn't have any hearing issues, he would have probably a little bit of cerumen buildup in there. Okay, now I'm going to do a few hearing tests on you, okay?
Mhm.
I'm going to have you cover up your ear. I'm going to whisper something, and then I'm going to have you repeat it back to me, okay?
Okay.
1, 2, 3.
1, 2, 3.
Perfect. Okay, I'm going to do the other side now. 4, 5, 6.
4, 5, 6.
Okay, perfect. Now I'm going to do some of this vibrations to see if you can hear this as well. It's just testing out the pitches.
Mhm.
Let me know when you hear it stop.
No.
Okay.
You can hear it. Yep. Still good. Still good. Still good. No.
Okay. Now I'm going to do the same thing on your other ear.
Mhm.
Let me know when you hear it stop.
No.
Okay.
Yeah, I hear it. No.
Perfect. Okay. Now I'm going to have you look at me, and I'm going to hold it like right in the mid of your face, and I'm going to see if you can hear equally in both ears, okay?
Okay.
Do you hear equally in both ears?
Can you do it again?
Mm-hmm.
Yeah.
Okay, perfect. Okay, now I'm gonna look at your nose and your sinuses, okay?
Mhm.
So just looking at you right now, your nose is symmetrical. I don't see any deviations or anything like that in front of you. Do you have any pain or tenderness when I touch your nose like this?
No.
Okay, I'm gonna push one of your nostrils and have you breathe in and out of the other one. Any difficulty?
No.
Okay, we're gonna do this. You want to? Okay, perfect. Now I'm gonna feel your sinuses. So let me know if there's any pain.
No.
No pain?
No.
How about down here?
Mm-mm.
Good?
Mhm.
Okay. Any pain from that?
Nope.
How about down there?
Nope.
Not on that side either?
Mm-mm.
Okay, perfect. Now I'm going to look inside of your nose, okay? So maybe tilt your head back a little bit for me. It looks moist and it doesn't seem really dry or anything like that. His septum seems to be straight. I don't see any trauma of any sort, so that's good. Perfect. Now I'm going to look inside of your mouth, okay?
Mm-hmm.
So if you can just open your mouth for me. Do you bite your cheeks?
Maybe a little bit.
A little bit, okay. Cause I do see a little bit of that, and I see where you've had your fillings. Can you stick your tongue out for me and say ah? Perfect. The uvula is lifting up. The soft palate seems to be intact. So perfect. Thank you. Now we're gonna test your vision, okay? So this chart's gonna be 20 feet away from you, and I'm gonna have you read the lowest line that you can while covering one of your eyes.
Okay. LEFODPCT.
Perfect. That would be 2015 vision.
Okay.
Now I'm gonna have you do your other eye.
LEFODFCT.
How about this line?
Okay. DEFPOTEC.
Okay, so you're between 2020 and 2015 vision, which is good. Now I'm going to test your near sight, your near vision, and I'm going to have you hold this about like how you would hold like a book or a piece of paper while you're reading it, and then point to a line and read it to me.
With my, do I have to close my eyes?
Yes, you have to cover one of your eyes, please.
937-826.
And what line was that?
Oh.
So 2025 vision, that's really good.
428739.
And that is 2020. Okay, perfect. Okay, now the next thing I'm going to have you follow my finger, okay?
Okay.
So that means I'm going to put my finger in front of you, and you're going to keep your head still, and you're just going to follow it the way that I move it.
Okay.
Okay? Oh, keep your head still, yep. Okay, I'll start again. Perfect. During this test, I'm just going to have you sit and stare at an object behind me, and I'm just going to see if the light hits the same place.
Okay.
On both eyes, which it does, which is perfect. Okay, thank you. And now I'm just going to look at your pupils. They seem to be both in the center of your eyes, equal in size, which is good. Okay. And then now I am going to have you look at this pencil behind my head, okay? And I'm going to have you cover one eye. Okay, now uncover your eye and cover your other eye. Perfect. So your eyes didn't move. They stayed focused. And the next thing I'm going to do is a pupil response. So I'm going to have you just stare at me, okay? You get a direct and a consensual response, which is good, which means that everything's reacting right. And the next thing I'm going to do, I'm going to have you stare at my finger. Don't move your head or anything like that. Just follow with your eyes, okay? Perfect. And then we both move to the same time. That's what we wanted to see. And the last test I'm going to do is just to look at your eyes a little bit closer, okay? I'm just going to have you close your eyes. So they're closing symmetrically. Your eyebrows seem to be symmetrical. Now open your eyes up for me. Perfect. Corneas are white. I'm just going to pull down a little bit, okay? Look at your conjunctivas. They don't seem to be irritated. I don't see any foreign objects. So that's good. And that concludes our assessment. So thank you very much for allowing me to do this assessment on you.
No problem.